Hello, everyone, and welcome to the webinar today with OCO Global. We will be talking about UAE healthcare and life sciences, a market overview, and we have an excellent panel of speakers with us today here with Vandana Nair, who is the commercial specialist at US Consulate and also the healthcare and life sciences sector specialist. We also have here with us Joe, the senior director from Aetna, one of the pioneers of telehealth in this part of the world. And we have also here with us Khalid, who has very kindly agreed to join us and will be talking about some of the legal considerations while doing business here in the UAE. So without any further delay, I will move on to the next slides. Here's the running order today. This is me, Vinita, from OCO Global. We're also the Middle East representatives for the state of Washington here, and we're based here in Dubai. We're headquartered in Belfast, in Northern Ireland. And yeah, happy to be working with the state, and let's hope that we have some really good things going forward. And then there's Vandana, Joe, and Khalid, like I mentioned. Just a quick overview on the big C word that's pervaded all our life in the last 1 year, year and a half. The UAE has managed COVID reasonably well over the last year and a quarter. We've hit over 60% of vaccination drive, and that's quite encouraging. Life has come back to normal when compared to a lot of countries all over the world, which is quite encouraging. Next slide, please, Abby. Just an overview of our presence. Like you can see, we have a presence in almost every continent right there, and we're happy to help wherever else you need help. Next slide, please. So that's us right there with 800 plus projects, 100 plus of us, fast growing company. Again, working with over 10 states in the US. So very excited to be working with Washington. Next slide, please. That's our team right there. About 13 of us. Close to 100 years of experience combined, and with a very multicultural and diverse team. Next slide, please. So we'll very quickly go on to the region as such. For those who are unfamiliar with the region, I think the most interesting thing about the UAE is the fact that we are able to access 2/3 of the population in and about an 8-hour flight distance. And that essentially showcases the connectivity that UAE is able to provide to the entire world. Next slide, please. So the GCC, and that is a term that you will hear very often going forward, is a combination of these states that you see right there, countries, sorry, that you see right there with Saudi Arabia, Oman, Qatar, Bahrain, Kuwait, and the UAE. Next slide, please. One of the things that has got us most excited here in the UAE, and not just the UAE, if I may say so, is the Expo 2020 event, which is a bit of a misnomer now, given that we're in 2021, but just like a lot of events have now been moved, so has the Expo 2020, which is now to be held in 2021, with an excellent build that has now been opened to the public with 3 main themes around opportunity, mobility, and sustainability, which, if you think about it, pervades across all, irrespective of all sectors. Really huge event. We're expecting over 25 million visitors, and we have some great events planned ahead as part of this show. Next slide, please. And that's the legacy part of Expo 2020, which is District 2020. So this is going to be a space that is going to attract, I think, more than anything, the future of the world. Again, it's a technology-centered space where they're going to be attracting companies from the tech space across mobility, across sustainability, and these are the sort of some of the big buzzwords around District 2020. Next slide, please. And I am now going to very quickly pass it on to Vandana, who has joined us, and she will talk you through the healthcare and the life sciences sector, and also give you a bit of an overview about Arab Health. Now, Arab Health is a very important show, especially in this part of the world, and there's a bit of a bio there on Vandana. We will obviously have been recording this session, so you will be able to go through some of her credentials. So Vandana, over to you now.
Thank you, Vinita, for that lovely introduction. Hello, good afternoon, good morning, everyone. My name is Vandana, as Vinita said, and I am a commercial specialist based out of the US consulate in Dubai. Next slide, please. So today we'll discuss briefly about healthcare in the UAE in general, what US commercial service is and how can we help US companies, and also a bit about Arab Health 2021. Next slide, please. Let's start with why United Arab Emirates. So UAE, being one of the most open economies in the world, is a significant export market for the US. So United Arab Emirates is United States, single largest export market in the Middle East, with over $17 billion in trade in 2020. UAE is also United States' fourth largest in terms of globally, in terms of trade surplus. UAE also has a diverse expat population. So there is almost 9.8 million people living in the UAE, out of which 85% are expats. This country is home to almost 200 different nationalities, which makes it really diverse. Moving on to the next point, strategic location. So, sorry, Abby, yeah. So the strategic location, so UAE enjoys beautiful, a location between Asia, Africa, and Europe, which makes it one of the top trading economy in the Middle East. Many foreign companies, US companies for that matter, they have their Middle East office headquartered in Dubai, and they do their business in the region out of their office based in Dubai. UAE is very good in terms of ease of doing business. There are no restrictions on profit transfer and also repatriation of capital. They also enjoy a competitive 5% import duty, which is also exempted for many sectors. There is no personal income tax and also no capital gain tax. And in English is accepted as a language of business, even though Arabic is the official language. Next slide, please. Let's talk about healthcare in the UAE in general. So UAE enjoys a very strong reputation in the region when it comes to healthcare. The sector, it is very well established, and it is home for many international brands and also many homegrown brands. You know, the pandemic has only increased the government's commitment towards the sector, where government has made huge investments in the infrastructure and technology to cater to the future pandemics. Moving forward, government is planning to come up with short-term and long-term plans. Short-term being, increasing the government budget and public spending on healthcare, and long-term being coming up with a new hospital facilities, new research centers to develop medicines, vaccines, new test kits, digitization of immunization IDs, and sourcing new supply chains for that matter. So Ministry of Health, which is one of the federal, which is a federal body in the UAE when it comes to healthcare, they are always looking at innovative ways to cater to the country's healthcare requirements, and US healthcare is highly sought after in this country. Next slide, please, Abby. Talking about areas of opportunities, telemedicine, until late 2019, telemedicine has always been 0.3 or 0.4. It was definitely an area of opportunity, but its relevance has increased post-pandemic. Especially, to reduce the number of patient visits to the hospitals and also movements between one hospital to the other hospital. Government is encouraging telemedicine very lately. And DHA, which is Dubai Health Authority, they have come up with so many new regulations last year to encourage opportunities in telemedicines in the country. For example, Cleveland Clinic in Abu Dhabi, they do most of their telemedicine, outpatient consultations via telemedicine in the country now. Pharmaceutical is also, UAE is mainly an import market when it comes to pharmaceuticals, which itself makes it as a sector of opportunity for US companies. There are many international giants, who has partnered with local companies here to deliver, to produce medicines in the country. Few pharma companies which are already in the markets are Pfizer and Janssen EMEA, which is the pharma arm of Johnson & Johnson's. Medical equipments, yes, the sector is rapidly growing, but UAE doesn't produce much of the medical equipments, which means there are opportunities for US companies to come here, set up their, medical equipment facility here. The few US companies who are already in the market, I would say, are Abbott, Medtronic, Johnson & Johnson's, and they have their regional headquarters based out of Dubai. Information technology, yeah, for over a decade, UAE is looking at moving to health information system, electronic health records, mainly to reduce the medical errors and duplication. Companies like Cerner Corporation and InterSystems, they are working extensively with public and private hospitals to set up these electronic health record system. Last but not least, smart technology and apps. So Dubai is definitely embracing smart technology and apps. In fact, DHA has introduced smart pharmacies where robots can dispense almost 12 prescriptions in less than a minute, from a pharmacy of over 35,000 medicines. In UAE is also a country where it has introduced robotic surgery and also AI, 3D printing in prosthetics. So yes, smart technology is definitely one of the sectors for US companies to look at. Moving on to US commercial service and who we are. So we are the trade promotion arm of Department of Commerce, International Trade Administration, and we help US companies export from the US by identifying the areas of opportunities and advising them on trading in the region. And we have almost 100 offices within the US and 70 offices outside of the United States. And these are the few services, which we offer US companies, including trade counseling, which helps US companies export if they are export ready. We also do some market intelligence report where we research on various markets, and this can help US companies to look at new markets, maybe consider additional markets, or go into a high growth, high challenging markets. Business matchmaking, yes, this is one of our flagship service where we help US companies matchmake with foreign companies here, help them find agents, distributors, or help them with joint ventures that fits their requirements. Advocacy and commercial diplomacy, I would say that would be one of our unique services, because advocacy center in the US help US companies level playing field in terms of competition with other foreign companies to bid on government tenders and government bids. Commercial diplomacy is again one of the services which we help US companies overcome trade barriers and trade obstacles by us lobbying with the host government. Trade and investment promotion program. So we run a lot of certified trade shows where representatives from US companies come to the local market, in this case UAE, and we help them meet with their potential agents, distributors. We also help them set up government to government meetings. So these are a few of our services which we help US companies with. Next slide, please. So these two are our current and major current and upcoming projects. One being Discover America. It's very close to my heart because it's the baby of commercial service in the UAE. So this is an annual campaign which is created by us in the UAE, which helps US companies to showcase their products and services. So this Expo edition of Discover America, runs until March 2022 to coincide with the grand finale of US Pavilion at the Expo, World Expo in March. So this includes various events like networking opportunities, business reception at the US Pavilion, trade talks, coffee chats, working groups, retail trade promotions in the hypermarket. These are just to name a few, but there are quite a lot, quite more than that. So we look forward to having US companies collaborate with us for this Expo edition of Discover America. And please feel free to reach out to us for more information. The next major upcoming project is a trade wind, which is huge. So we are anticipating around 100 US companies from various sectors to come to Dubai next year from March 6th till 8th, where we'll be helping US companies, the representatives of these US companies, to matchmake with their potential agents, distributors. In fact, there will be government to government meetings as well. Next slide, please. Let's talk a bit about Arab Health 2021, which is one of the largest healthcare trade show in the region. It is one of the, as I mentioned earlier, it is one of the perfect healthcare business platform for you to bring your brand into the Middle East, mainly because there will be people attending from various regions, including Asia, Africa, and Europe. So the footfalls for this trade show is really, really high. For example, Arab Health 2020 witnessed around 57,000 visitors and more than 4,000 exhibitors from over 170 countries, which makes it huge. This year, the show is happening a bit different, mainly because of the pandemic. Every year it used to happen in Jan. This year it's happening in June. And also it has two versions. So the live show is happening from 21st till 24th of June at the Dubai World Trade Center. But there is an online version happening over 6 weeks where there will be various seminars and conferences based on the theme for each week. So this year, as I said, they have theme weeks spread over these 6 weeks, themes ranging from medical equipments, pharmaceuticals, telemedicine, artificial intelligence, healthcare infrastructure, just to name a few. So we are really looking forward to these theme weeks, actually. So it's going to be quite big this year. Another thing is it is happening along with one of the major laboratory show here in the Middle East, which is MedLab. Every year MedLab used to happen exactly after Arab Health, but this year they have decided to collaborate. So both live show and the online show is both are coincided with MedLab. There is a huge presence for Arab Health every year. So last year we had around 272 companies exhibit under the US Pavilion and almost 100 companies outside of the US Pavilion. And we also had almost 12 states represented at Arab Health last year. And also ambassador will be giving opening remarks, will be doing a ribbon cutting. There will be networking event for exhibitors. So it's quite huge, and the US commercial services involved quite a lot at Arab Health because that is one of our flagship trade shows. Next slide, please. Moving on to the top tips for doing business in the UAE. I would always say network, and I would like to say it bold, like network, because, that is something which is very, very valued in this country. If possible, join industry associations, trade associations like US UAE Business Council, tap into their goodwill, get advice from them in terms of, get their advice, support and guidance in terms of doing business in this country. And also feel free to reach out to us anytime. We are here to help and support. See you on Friday. That is something which you hear very normally in US, but here the weekends are on Fridays and Saturdays. So please, get to know the local customs and traditions, the business culture before flying out of the US to do business in the UAE. Face-to-face meetings are highly appreciated, even though in the current situation, virtual meetings are acceptable. They are considered normal, but business are done mainly on personal relationships in this country. So they prefer having, face-to-face meeting. Each emirate has its own jurisdiction. Yes, UAE is a federation, but each emirate has its own rules when it comes to commercial activities. So do your homework, see what exactly will fit your requirements for your business, and select an emirate accordingly. Free trade zones. So when you can set up your company in a free trade zone, and you can have 100% ownership of your company. That is why UAE is arguably one of the most sought after trade destinations in the Middle East. But free trade, when you are set up in a free trade zone, you are limited to doing business with a company within the trade zone, and there are you cannot legally do business with a company which is established outside of the trade zone. So again, weigh in various options, see what suits your requirements before deciding on whether you need to do a business in free trade zone or onshore. Next slide, please. Yes. So UAE is a highly rewarding place to work and live. We normally advise companies to come here with an open mind, ready to face challenges, twists, and an exciting journey. We, the commercial service, are always here to help and support you. Thank you.
Thank you very much for that, Vandana. That was really informative. And I think you raised quite a few good points there regarding some of the opportunities in the region, and also that point which should be in bold is network, network, network. I think that's couldn't be truer, especially in this part of the world. And you also have a host of officers coming from across the region, isn't it, during Arab
Yes.
Health, where
Yes.
where the companies can. So can you just talk a little bit about that?
Sure. So I can talk about what happened last year. So we had around 21 commercial specialists from various countries, including Asia, Europe, and Middle East, come here. And the benefit for US companies is you can hear from all these commercial specialists about their market. We also organize various regional trade talks. So we had a regional panel on Gulf. We are also looking at having a regional panel on Latin America, if we can have a commercial specialist from those countries this year, pending all the travel concerns. But we are also looking at having 2-3. Last year we tried with only one panel, which is regional panel on doing business in Gulf. This year we are looking at doing business in Asia, where we are planning to bring specialists from Southeast Asia, including Singapore and Malaysia, and also from India and Pakistan. We are also looking at doing business in Gulf, Levant panel. So it will be quite a lot of programs from the US Commercial Service.
Yes. Sounds quite comprehensive. So,
yeah.
I think that would be a great opportunity for companies to actually come out this year with the hopes that the skies will open up by then and the borders will also open up by then. And yeah, looking forward to a great show this year, Vandana. Thank you very much for that. And with that, I will now invite my next speaker, Joe. I mean, I just provided a brief introduction there, but Joe here is, like I said, he's been a big champion of telehealth over the last few years. And I was just, before this session started, I was just telling him, I heard about it only a couple of years ago. Joe's been talking about it for, probably nearly a decade right there. And, it's all come to fruition now. And Joe, we would love to hear about the journey, about, how V-Health has taken shape and what are some of the great things that you're doing in the region. So over to you now, Joe.
Thank you so much, Vinita, and hello, everybody. I'm delighted to be speaking with you. Yeah, so my name is Joe Hawayek. I head virtual health on behalf of Aetna. I work for Aetna, the medical insurance company that you know, and part of it, which is outside the United States, Aetna International. So I'm going to speak to you about the trends and regulations for telehealth service providers. as I said, this is a nice old image of myself. I am the general manager of Virtual Home Healthcare. It is a company established by Aetna in the Middle East as a healthcare provider, as a telehealth provider, also a home care services provider. My expertise and my background is over 20 years of experience in healthcare and healthcare technology. So really the principle of delivering remotely healthcare services to patients which are not in the same place as the doctor. I've done a lot of it and I've spoken a lot about it, and I'm really delighted to see it really coming into people's hearts and minds very lately. The next slide, please. So vHealth is virtual health, is Aetna's solution to its members, its customers' healthcare. Really, it's a primary care service delivering general practitioner consultations, family medicine, internal medicine, really the primary care end-to-end of a person's health needs. And so we do this around the world. We deliver it in a number of markets around the world. As I said, I'm part of Aetna International, so everything outside of the US. There's in Europe, there's in the flag you see in the Middle East, that's the United Arab Emirates. India, Thailand, and Singapore are our main markets. And really, we find it's very effective because it helps people avoid going on to further medical care. It helps people avoid having to go physically to a doctor, go physically to a pharmacy, because of course, these trips are sometimes a waste of time. We estimate around 2.5 hours to maybe 3 hours round trip if one was to go to a 20-minute consultation with a doctor. So really, we give back all of that time savings. And also, it's cheaper on the payer of the service because it's really the clinical need and the medical need of a patient rather than it's being incentivized to do more. And in all of these markets, really, I'm going to zoom into the UAE that you see there in the next slide, please. So of course, out of the Middle East, we cover Saudi Arabia, Oman, Qatar, Bahrain, Kuwait. But the United Arab Emirates remains our regional hub. So out of here, we deliver our services. This is where we have a majority of our staff, our employees, and this is where we have the license by the Dubai Health Authority to deliver telehealth services. But it goes beyond telemedicine and telehealth because we recognize there is more services involved in delivering healthcare to a patient. So for example, tests, blood tests, lab tests, instead of also asking our customer to go to a lab, to go to even a pharmacy or a minute clinic or a health hub or all these different types of places where they can just do a blood test, we can send the phlebotomist over to their home. So it's accessing them wherever they are, maybe at home, maybe at work, maybe in the gym, wherever they are. We can send that to them. Imaging is an interesting point. We are about to start to find innovative ways of sending X-ray, mobile X-ray machines to the home. But in the meanwhile, we're asking our members to get it in a medical facility. But they can then send us the images through the app, through the technology, instead of them having to worry about interpreting it or bringing a printout and all of these things. Medication, similarly, we can send the medicine to the place of the customer. Again, instead of helping them to avoid going to the pharmacy. And finally, specialist referrals, of course, like any medical service, primary medical care will identify what is needed in terms of the specialist and then refer the member onward to that specialist. It could be a dermatologist, it could be physiotherapist, all of these different specialties are within our network and we send the member to them. The next slide, please. So that was an introduction. Really now I'm going to dive into really the purpose of the presentation. The definition of telemedicine, widely accepted, is that it's the exchange of medical information from one place to another through electronic communications, of course not on a pigeon, to improve a patient's health. So really it should be focused on a patient, on a medical record of one patient, and it's the exchange. Now, it could be between the doctor and the patient, this exchange of information happening, or it could be often between two doctors. Imagine a case where an attending doctor is seeking advice from a more specialist doctor in their field, and so that's also termed telemedicine. There are a number of different types of this, either a prearranged telehealth visit, when there's a booking and the doctor calls the patient at the time of the appointment. There's a virtual check-in, which is more ad hoc and drop-in and walk-in type of concept, where a patient can just call a number and sometimes wait maybe in a queue for a short time and then be allocated a doctor to speak with. And then e-visit or digital visit is really with less interaction of the patient even. These are where there are medical monitoring devices, glucose devices, oxygen devices, all of these sort of wearables and machines or devices that can remotely monitor the patient and send the information back to the doctor. The doctor would be monitoring this information, and if it breaks a certain threshold, it would raise an alarm. Telehealth, as Vinita was saying, I've been talking about it for many years, and it's been growing slowly for many years. It's been growing for a number of reasons. Around the world, aging population, even here in the UAE, population has been aging, so less ability for people to pick up and go across to see a medical provider. Government support has been very high for telemedicine around the world, and especially here in the UAE. As mentioned just earlier by Vandana, the Dubai Health Authority has put out the regulations and standards for telemedicine in Dubai. And then the Department of Health in Abu Dhabi has put out an equivalent standards and regulations for telemedicine in Abu Dhabi. And then there's the Ministry of Health and Prevention, which also overarches these both of these authorities and also supports. And all of these authorities have their own service as well. So remember, they are not only a regulator, but they're also a provider of healthcare services. So they have set up their own delivering telemedicine services to citizens and residents of the UAE. So there's a lot of government support. And one of the last reasons also why it's growing gradually has been chronic disease. Telemedicine is really effective with those diabetes patients, longer-term metabolic diseases, people who are managing a condition they're not going to get rid of, but they have to manage it closely, and they can do it remotely through the help of the doctor who's sitting on another side. The next slide, please. Really, there used to be conditions around, more conditions around telemedicine. So the regulators used to say, okay, you're allowed only if. So if your patient is in a rural environment, in a rural setting, so they're far away, they can't access care, they don't have somebody of that specialty in their village or their area. So those used to be conditions. Also, they used to pay very close attention to approving the originating sites. So the provider who's delivering it had to meet a lot of criteria. Also, the one receiving it had to be having some criteria. For example, on the receiving end, the patient might not be permitted to be by themselves. They needed to be with a doctor. So imagine a scenario where a patient is in a hospital and then the doctor is dialing another doctor in another specialist hospital. So things like this, a number of these conditions. But all the while, the return on investment had been building up. It is relatively obvious to some of us. It's improved patient satisfaction. Patient can get a quicker appointment sooner, and they can get it briefer. They can get access to any doctor, better doctors than the ones maybe that they have physically in their neighborhood. It reduces the cost of care as a result of this. It improves the reputation of the provider if the medical provider is able to offer different channels of accessing their services. It increases productivity. Less and less doctors are unutilized or idle, waiting for a patient to walk in. They're able to deliver their services to a wider radius and a bigger market. So you can see a whole list of these ROI or benefits or return on investments. Next slide, please. And then came COVID. So a year ago, around this time, a year ago, lockdown spread, from one geography to another around the world. And people started to really see telemedicine as an answer to really social distancing. They still needed to speak to a doctor, even if it wasn't about coronavirus, but they were hindered from traveling to a doctor. So you can see some of these scenarios. A patient could have mild symptoms, needs to be seen, or needs an evaluation, and has been told not to go to ER, of course, because there's a risk of them spreading the disease there. There's a patient who has no symptoms, but knows that they have contacted someone who is positive for coronavirus, so they need to be evaluated. Another scenario, a patient needs care for an unrelated reason. Like I said, maybe they're diabetic. They still need to access their diabetes medicine. They still need to get their diabetes checkups, but they can't go in person to those facilities because of lockdown, because of conditions around protecting them and the hospital from coronavirus, so they access their care remotely. A patient might have severe symptoms of COVID-19 and is in the hospital, maybe, and in a COVID ward and being looked after like that, but they still have other conditions or specialist conditions that they want to consult on, so they can do that remotely. And finally, physicians themselves, also they need to be protected. So them delivering telemedicine remotely keeps them further distant from potential risk of catching coronavirus and keeps them productive for longer. Next slide, please. So all of these reasons, on the 25th of March, which is around, as I said, a year ago today, the Dubai Health Authority permitted all healthcare facilities to start to deliver telemedicine without them having to go and seek a specific license for it. This was a temporary measure, but it still continues today. So all of the major hospitals, major medical clinics were permitted to do this with the strategy of helping protect the safety of the patients. The next slide, please. And what we found as a result, immediately the next week, you had a large number of providers advertising for their telehealth, telemedicine services, interchangeable term, telehealth or telemedicine in this case. It could have been very simple technology-based, so it's really a phone, that's all you need. They needed some way of identifying who the patient was. So they take ID, date of birth, these kinds of details. But otherwise, there didn't need to be much in the name of video, for example. They could deliver telemedicine over the phone. The next slide, please. And so you saw, these are just a number of images from at that time. These were some of the first movers. As I said, within a week, they started delivering teleconsultations to their existing patient base. Next slide, please. And then the Telecommunications Authority, it's called the Telecommunications Regulatory Authority. They are a key player here because it's tele-based or digital-based. And previous to coronavirus, they had banned the use of a number of video apps. But on the 30th of March, so that's 5 days after the Healthcare Authority, they also opened up and permitted the use of all of these applications you find on this list. And since then, they've even enhanced and added some more. So you can see the impact of coronavirus and the pandemic on the regulators, and very swiftly opened up the access to telemedicine. Next slide, please. And then there's the insurer. Of course, the insurance companies would reimburse. Traditionally, before this period of time, they had conditions also like the ones we spoke about earlier. They only would reimburse if it was a live video or a live audio consultation, only if it was a remote patient monitoring, if it was a store and forward, and wouldn't accept email or fax as a way of, these are some archaic, maybe even the use of fax is probably funny for some of us in this presentation, but these were written in the regulations and in the insurer's policies. So the insurance company would pass this on to their customers. Immediately, what changed when the regulators said opening up, and they mandated that the telemedicine companies charge the insurance companies, that they mandated, in fact, the insurance companies reimburse these consultations. They allowed it to be delivered over a smartphone, living in any geographic area. It could be in an urban setting, it could be in a crowded place, it could have physical clinics even immediately within the same block where they lived. But it encouraged the reimbursement of these. The one condition that still sits across all of them is really for the telemedicine provider to request consent from the patient accessing the service and documenting it. It's very important that the patient is aware and familiar of what is the nature of the service they're getting, what are the boundaries of the liability of their provider, and what is their responsibility in this process. So there's to this day, very keen interest in capturing this consent. I suppose it's a little different from physical care because the patient, by virtue of being physically present somewhere and they're walking into a doctor's clinic, they're assumed to have done it on their own conviction or consent. with telemedicine, there needs to be documented evidence of this. The next slide, please. So really coming to an end, this is looking at the future and some of the risks. So as we said, any provider right now in the UAE is encouraged and permitted and supported in delivering telemedicine services, but really there's a risk of them not following the regulations and the standards. Those are published. You can find them online, and the Dubai Health Authority has theirs published, the DHA, and there's an update coming out in just a few days from now. The last update was September 2019, and now there's an update to those regulations. And the Abu Dhabi Department of Health also have theirs from October 2020 was their latest, and are continuously working on updating them, keeping them in line with international standards. And so the risk is that providers don't follow them. And some of the simple things there are the recording of consultations, the recording of consent, like I said earlier, recording of the medical record, ability to audit all of the previous consultations, and some quality standards of patient safety and what they're permitted to prescribe, which medications they're not permitted to prescribe without seeing the patient physically, and all of these sorts of things. The second risk moving forward is physicians under-documenting patient visits. So you see there's more reliance in telemedicine that the doctor writes down and documents the consultation in a lot more detail. In a physical consultation setting, they might issue doctor's notes or a referral letter or some kind of conclusion, but aren't usually as stringent with documentation detail. And finally, there is a risk as an insurer if it was to be overutilized. And the reason we say this is that as long as it's being utilized correctly and not needing the patient to go on to physical care and be seen again, then it's avoiding onward care. It's helping the patient avoid unnecessary interventions, unnecessary medication. But the risk is sometimes that a patient might use telemedicine, but yet still go and redo their consultation in a physical setting, and that then would create a double cost and double booking. It's important for us to track this and to ensure that they're getting the right level of quality in their telemedicine, so that they don't need to go see anybody else. That's it from me. These are the future and the risks. I shall pass on to the next, to Vinita, I think. Hello.
Yes. All right. Great. Thanks so much for that, Joe. I mean, that was really comprehensive, as comprehensive as you could get in 15 to 16 minutes time. So thank you for that. I mean, would you say that, you know, for some of the new entrants of telehealth providers, do you think it's become a saturated space now, given that, you know, like you said, so many...
No, not at all. Not at all.
Okay.
So what exists right now are 3 providers in Dubai and 1 in Abu Dhabi. The 3 in Dubai is, and all of these 4 in total are looking after primary care still. So there are areas to go into other segments of the healthcare sector, specialist care. There are people doing even dentist appointments and assessments over telemedicine, so teledentistry. Mental health is a huge one. There's a big gap in the space of delivering mental health consultations over telemedicine channels, and there's a huge opportunity there because of the stigma still associated with mental health. Many people would prefer the anonymity of not having to be seen walking into a mental health facility and all of these things. There's a lot to be done in chronic care, diabetes, all of these areas. So there is genuinely a large number of specialist areas that new entrants could make a move into.
All right. Okay. And God knows that, you know, mental health has come into play over the last 1 year with all of us working from home and, you know, not being able to get out as much as we can or meet people as much as we can. So, yeah, I think that's definitely an area that needs to be addressed. So once again, thank you very much for that, Joe. I will now invite my next speaker, Khalid. Khalid here is a partner with Keystone Law, based in Abu Dhabi, but I believe headquartered in the UK. And Khalid specializes in corporate and commercial law and also regulatory compliance, which I think is going to be a very, very important part for a lot of players in the healthcare and life sciences sector who are looking to enter UAE as a potential export market. Because, you know, again, given the fact that UAE is a relatively young country, I think it's still sort of catching up, but also trying to be the front runner at the same time when it comes to regulatory compliance. And I think, you know, consulting with a law firm that understands the lay of the land and is keeping abreast of the constantly evolving regulations in the sector is very important. So over to you, Khalid, now to talk about doing business here in the UAE, and you know what are some of the things that newcomers need to bear in mind when they're engaging with probably potential partners and agents and distributors. So yeah, over to you, Khalid. Thanks.
Thank you very, very much for the introduction, Benita. And I'd also like to say a huge note of thanks to OCO Global for hosting this seminar, and also to everyone watching from the state of Washington. We're very, very excited to be able to talk to you virtually today, despite the time difference. And we very much welcome the opportunity to receive inquiries from anyone at the state of Washington about how to set up and get going within the United Arab Emirates. So without further ado, if I might have the next slide. So a little bit about Keystone Law. So we are a law firm founded in the United Kingdom, premised on the idea that we want to offer something very different to our clients, which is about innovation and creativity. We genuinely want to be a different firm, and we've been going since 2002. We now have over 400 lawyers working for Keystone Law across the United Kingdom, Northern Ireland, the Isle of Man, the Middle East, where I'm based, and Australia as well. And we pride ourselves on the fact that all of our fee earners have a huge amount of flexibility, as well as an amazing entrepreneurial spirit to help clients in whatever way they can, free from the shackles of the constraints of big law firms, perhaps where they've come from. So I'm very confident that anyone who inquires about our services from the state of Washington will probably find that we operate in a very different and unique way, which is pretty much premised on what the United Arab Emirates is based upon. It prides itself, as Benita said, on trying to be the front runner whilst catching up with the rest of the world. And that's a very unique proposition for the UAE to be in. So if I might have the next slide, we'll talk about the first topic. So what we've done is we've divided up our presentation today that I'm delivering around 6 topics that you'll need to focus on if you want to set up a business in the United Arab Emirates. And I'd like to go straight on to the first one, if I might have the next slide, which is talking about your business activities. So when you set up a business in the United Arab Emirates, your business plan is absolutely essential to talk to and to use as a reference guide for government stakeholders, potential investors, clients, and suppliers on what it is you're going to do. Now, the reason that a business plan is essential is because there will be many, many people that you encounter within this region who are very, very, very capable, intelligent in their own rights, experts in their fields, but they may not have a shared sense of understanding of what it is you're offering as a healthcare provider or a health tech provider or someone within that ecosystem. And it's very important to use your pitch deck and your business plan to explain what your activities are going to be, because your activities will then govern the type of company that you set up. So when you approach, for example, a free zone, as Vandana talked about earlier, and you ask them if you can set up a business, the free zone governance team, the licensing team for that free zone, the first thing they'll ask you is they'll say, well, what are your activities? And what they want to do is they want to make sure that the kind of corporate activities that you're going to offer fit into the regulatory framework of that particular free zone. And the reason for that is that every activity comes with its own regulatory obligation. So if you want to offer, for example, healthcare as part of your company activities, you might find that there are regulatory obligations on what you can and cannot do. So the activity category that you present to the free zones is very, very important. And you must bear that in mind whenever you want to set up a company here in the UAE. If I can have the next slide, please, we'll talk about the territories. So again, drawing on what Vandana said earlier about the jurisdictions within the United Arab Emirates, there are 7 emirates within the UAE, and each of them is their own jurisdiction in their own right. And it's very, very important that you think very carefully about who it is that you want to serve as part of your client base. Which clients do you want to look after? Which suppliers do you want to bring into your ecosystem? And that you tailor the location of your company in order to fit in with that particular model. So you might decide, for example, that you primarily want to serve clients within the Emirate of Dubai, and you want to launch, for example, telehealth services, as Joe talked about earlier. You may be able to do that from the Emirate of Dubai and offer those services across most of the UAE. But if you want to then talk about expanding and offering services in Abu Dhabi, that's a very different ballgame altogether, because Abu Dhabi does not permit companies in Dubai or other Emirates to offer services directly into Abu Dhabi. You have to be registered in Abu Dhabi. You have to have a trade license from the Abu Dhabi municipality or one of the free zones in Abu Dhabi in order to offer services within that particular emirate. So it's very, very important you bear that in mind whenever you're thinking about the location. And the tip that I've laid out on the screen here is that please don't feel compelled to follow the pack. Don't feel compelled to follow in the footsteps of other healthcare and telehealth and health tech providers in the region or in the UAE, because you may find that actually they've set up their companies based on what the laws said at the time that they set up and the offers that were available to them. But by the time you want to set up your business, things will have changed, and the UAE is continuously evolving to make itself more competitive and a dynamic place in which to do business. So it's very important to obtain up-to-date legal and regulatory advice on the type of business entities and the offers and the concessions that are available to you as a new business owner. If I can have the next slide, please. So, as I mentioned earlier, the type of clients that you want to serve is absolutely paramount to the location in which you set up your business. It's also essential that you take the approach that the way that you did business in the United States and within the state of Washington may not be the most appropriate way of doing business in the United Arab Emirates. This country is rich with culture. It has nationalities, the population has nationalities stretching, I think, over 100 different nationalities within this country, perhaps even more, live and work in the UAE. And so therefore, you're going to deal with a client base who are far more diverse and with far more variations on their technical abilities, language abilities, attitude to risk as well. So my advice is that for anyone looking to take it clients out here is to have very easy to understand contracts that you present to them. Really, really simple contracts which present very clear demarcation lines on the responsibilities between yourselves and your clients. And to invest the time in having your contracts translated into Arabic as well. Obviously, you heard earlier that business is the internationally accepted language of the United Arab Emirates. But if you're going to be approaching government stakeholders, potential government partners and government clients, there's a general sense that they will expect to see contracts written in Arabic, because that's a sign of respect for them. It caters for their language and their understanding of how contracts work. And it shows that you're investing that time in order to present legal documents to them in their home language. The other thing to also think about is to take legal advice on the type of contractual provisions that you'll require in your contract to protect yourself against such very common issues that a lot of suppliers face in this particular part of the world, such as very, very long negotiation cycles, delayed payments, scope creep, which is very, very commonplace in this part of the world. And so you need to have access to good advice telling you about how to structure your contracts to avoid those issues and to mitigate those issues so that it clears a pathway for you to establish really strong and long-term relationships with your clients in this particular region. If I can have the next slide, please. Now, the subject of compliance is a very broad topic, and I'm not going to talk at length really about what compliance means, but as healthcare providers and health tech providers and other companies involved within the healthcare ecosystem, you will be aware that there is a huge volume of healthcare regulation that exists to regulate the way that healthcare services are built and deployed. And the United Arab Emirates is no different whatsoever. So at Keystone Law, we have very good teams who advise on healthcare regulatory regimes and how to comply with the regulatory regimes. And they also talk about, the regulatory regime talk a lot about standards of medical care, pharmaceutical products in terms of how they're deployed and marketed and sold, as well as incentives for healthcare practitioners to market particular healthcare products or services, and how some of them may fall foul of the UAE's very, very strong anti-corruption laws. So it's very, very important for you to be aware that not only in addition to the FCPA in the United States, which does continue to have extraterritorial jurisdiction within the UAE, it's very important for you to take advice locally from a law firm such as ours about exactly how the healthcare regulations operate within your sphere and how they will regulate products or services that you're looking to deploy. And just to give you an idea that if you were to look up details about the SEC's enforcement regime and how it does apply to companies based in the Middle East, you'll find a lot of information online about the SEC's enforcement action against companies such as Ericsson and Microsoft and other vendors, very, very large multinational vendors who've established a presence here in the Middle East, but because of the way that they've conducted their business operations, have fallen foul of the FCPA and foreign anti-corruption regulations. So it's very, very important to bear that in mind whenever you're structuring your anti-bribery policies here in the region, to make sure that they're adapted to local risks as well. If we can talk about the next slide, which is to do with employees, and it's very, very important for your business to take account of how it's going to manage and look after its employees within the United Arab Emirates. You'll find that labor law regulations within the UAE are evolving very, very quickly in order to provide a very competitive place to live and work. And you'll find also that a lot of the guidance out there about the labor law and how it functions in the UAE, guides, for example, that are published by multinational banks and some of the big four consulting firms, you might find that actually a lot of the guides are very useful, but also very outdated because of the pace at which labor law is changing within the United Arab Emirates. And so it's very important to obtain good, up-to-date advice on what the labor law says about how your companies will need to look after employees within your workforce. A couple of things I wanted to mention about this particular point, because multinationals tend to have very, very good compensation and benefits programs for their employees globally. And that generally means that you might be seeking to offer a much higher level of comp and ben sort of offerings to employees within the United Arab Emirates, far higher than perhaps the local labor law prescribes. And so what we do advise clients at length to do is to really look at the global compensation and benefits policies that they offer to their employees, especially when they look to harmonize that across the world, and to see how that fits in with the local labor law, to see whether those comp and ben thresholds exceed the minimum requirements set out by the labour law over here, or whether they need to be enhanced in order to bring them up to standard of what the labour law requires. There are other jurisdictions in the UAE, for example, the Dubai National Financial Centre and the Abu Dhabi Global Market, that also have their own HR and labour law regulations, which we also provide advice on. But it's important to note that they do exist, and so therefore there isn't going to be a unified approach to how you're going to be able to manage your employees, particularly if they're going to be spread over quite a large footprint in the UAE. And we also provide advice on how, as employers, you need to be very, very mindful about a concept called the end of service gratuity, which is a lump sum payment awarded to most employees, save for those in a DIFC, most employees who, at the end of their tenure working for a company, are entitled to receive a lump sum payment from their employer as a thank you for their longevity and the service that they've given to their companies. So we do provide advice on how to tailor the end of service gratuity package to make sure that it aligns with international pension plans and other benefits that companies like yours may be offering to their employees in the United States or in countries where they previously lived and worked. And lastly, I'd just like to mention something about expansion and how you need to think very carefully when you set up in the United Arab Emirates, just about what your next steps are going to be. A lot of companies in the UAE tend to do very, very well. And they often get very surprised when, perhaps 6 months, a year down the line, they're already having to think about expanding in terms of hiring new employees, opening up new premises, expanding into other jurisdictions where they want to offer services, perhaps even expanding within the Middle East as well. So it's very important to think about at the very early onset of your business, how to structure your business to be as flexible as possible so that you have the opportunity to expand without too much pain along the way. And you've got the opportunity to then scale up in terms of your operational footprint and to enhance your client base within the UAE as well. If I could have the last slide, which I'm going to talk about in terms of agency and distributor agreements. And this is something I'd like to provide you with a very short history lesson on concerning how the laws in the United Arab Emirates have evolved. So the United Arab Emirates was formed in 1971, and it drew upon advice and expertise quite heavily from lawyers in Egypt. Now, prior to 1971, Egypt has operated a number of its own court systems. A very, very successful legal market within Egypt exists. And they drew a lot of their jurisprudence from the time of Napoleon and incorporated a lot of principles regarding agency and distributor agreements from the time of Napoleon, who imported the Napoleonic Code, which is the precursor to the French Civil Code. And so in 1948, when Egypt enacted its own civil code, it drew upon a lot of that jurisprudence in terms of how to manage the relationship between agents in country and foreign principals in terms of their joint responsibilities. So when the United Arab Emirates was formed in 1971, it drew a lot of that jurisprudence from Egypt and employed a lot of lawyers and judges from Egypt in order to guide the country on how to establish its legal framework for a brand new country like the UAE. And they brought with them the concept of agency principles from France. So it's very important that if you're familiar with the concept of agency already, then you'll be familiar with broadly the concept of agency here in the UAE, in so far that there is an implied duty of good faith between principals and the agent. Agents here are very heavily protected from wrongful termination of their agency contracts. And it's very important that you recognize that the agents here will expect a degree of exclusivity within certain territories within the UAE in order to offset the cost of their investment to build a market share for your company. And so that has to be taken into account whenever you approach agents to establish an agency relationship. But on the flip side, if you do establish an agency relationship, the agents will be the exclusive importer for your particular product, which means that your agents will have the power to block infringing products or grey market imports as well which might then serve to undercut the regulated or retail pricing that you want to set for your products here in the UAE. So there are several advantages to using an agent. And the last but no means least is that you'll have the access to very good Emirati management teams who have an excellent understanding of the commercial environment in which they're operating, client bases, and relationships with hospitals and regulators that you'll need in order to establish an ecosystem through which you can sell to. So from my side, that pretty much brings what I wanted to say to a close. I'm very grateful for the opportunity to be talking today, and certainly look forward to any other inquiries that you might have after you watch this recording. So thank you.
Great. Thank you very much for that, Khalid. And I think you bring up a very important point there regarding agents. And I think UAE has a bit of a bad rap when it comes to being a protectionist state almost there. When you said that, the interests of the agents are, upheld sometimes more than that of the foreign company that's operating in the region. So in my mind, the due diligence becomes very, very important before engaging with an agent, isn't it? I mean, and would you be able to provide due diligence services to an extent to companies there?
Yes, we do. So we work with a number of partners actually who offer due diligence services, and we're able to guide clients on the best possible due diligence services that they should be procuring in order to comply with their compliance framework back, for example, in the United States. But the point you mentioned about due diligence cannot be understated. Even if it's just basic desktop research on the identity of an agent and who the executive team are and any major contracts that they've signed with clients that they represent over the last few years, it is extremely important to conduct that research as well. But the other thing I'll also say is that good distributors and agents will provide you with that information if you ask them for it. So we tend to recommend good distributors and agents who are really happy to sort of explore opportunities to work with their principals and to, present a sort of an open hand in terms of how they can represent foreign principals with all the information that foreign principals should be asking for.
Right, great. All right, thanks, Khalid. And with that, lady and gentlemen, we come to the end of the session today. So thank you very much for joining us. Thank you very much for supporting the state of Washington. And we look forward to your continued support for the companies who are, like I said, looking to the UAE and the region as such as a potential export market. Thank you once again and have a good day.